This is the full body CARS routine. So we're going to be going through a routine. Should take anywhere between, depending on the tempo at which you're going, it can be anywhere between 6 minutes to up to 10 or even close to 15 if you're going super slow. So the intention of this routine is for joint health and maintenance. So we're going to be taking each one of our joints, pretty much almost all of our joints in our body, through their full pain-free ranges of motion. CARS is, again, it's supposed to be used as joint health and maintenance, so we're maintaining the range of motion that we already have, although if you do this every day, you will absolutely improve range of motion, and it's meant to be done every day. It's also can be used as a assessment tool, a self-assessment tool. Let's say I'm doing a CAR on one side, this is a shoulder CAR, and then I go to the other side and I'm like, wow, I can't do that nearly as well. I have to compensate to get there. That tells us we have to focus more on shoulder mobility on that side and then see how that translates to the rest of our movement and if it has any impact on our overall movement and well-being. So CARS, controlled articular rotations, slow joint rotations, pretty simple. The one thing that we want to keep in mind while we do this routine, the joint that we're working on, so in this case I'm doing a shoulder CAR, we want to do our best to make that the only joint in our body that's moving. Kind of a difficult task because all of our joints are connected. But for instance, if I'm doing my shoulder CAR and I'm doing all of this movement, am I really getting mobility at the shoulder? Sure, but I'm not training those tiny muscle control, motor control of and joint actions of this shoulder as much as we would want it to be done. So you want to think about the rest of your body, whatever joint you're working on, the rest of your body is in cement, stuck. And one great way to do that is through a technique called irradiation. So it's a really simple concept. You're just breathing in, thinking about having that breath fill your belly, and then what I'm going to do is gently pack that breath down. Even though there's no air in our belly, there is pressure. I'm going to pack that down with a slight moderate contraction through my trunk, and then let that spill through my whole body. So now I have a gentle light contraction through my whole body. That's the concept of irradiation. We don't want to be holding our breath when we do that, so we're going to breathe in, pack it down, and then continue to breathe normally while we maintain that moderate stability and contraction through the body. Now, if you're new to this and that's difficult and you don't understand it, don't worry about it. Just focus on the movements. This is supposed to be simple. It's supposed to be easy and fun, and it's supposed to be a way to get all of our body moving in a quick, easy way. So, got that out of the way. Let's start. So we're going to start with the irradiation. Deep breath in. Gently pack that breath down. Now we're going to begin with our spine. So starting with our neck, I'm going to drop my chin towards my chest. Once I can't move any further, I'm going to rotate to my left side. Chin to my armpit. Then I'm going to drop my left ear down towards my shoulder and roll my head back into extension and over to the other side, bringing my right ear to my right shoulder. Once I can't go any further there, I'm going to rotate my chin towards that side and back to center. I'm going to do one more rotation here in this direction, and then we're going to go the other direction. Doing your best to keep your body still. I feel a little bit of myself compensating, so I'm going to try to lock that in. Now I'm going to go the other direction, rotate the chin to the right side. Drop that right ear to right shoulder. Roll the head backwards, chin to the sky. You should feel a stretch in the front of the neck. Ear to the left side, chin to the shoulder, back to center. One more rotation in that direction. And back to center. So that's a neck CAR. That's the first movement that we're doing. Key consideration here while you do this is if you feel pain or restriction in the direction that you're going, which was what we would call a closing angle pinch. If you feel a closing angle pinch, take some intensity off that and just move around that closing angle pinch. Any sensation you feel on the opening joint angle side. So if I'm turning to my right, all of my joints are closing on the right side, but on the left they're opening. Any sensation over there, unless it's extremely intense and painful, but anything that we feel over here is good. If we feel stress, if we feel discomfort, if we feel stretching, that's great. We want that opening angle sensation, not closing angle. So remember, if you get a closing angle pinch or pain, just take the intensity or depth off just a little bit and continue moving around that pinch. So next we're gonna spill this down into the rest of our spine. So you're gonna bring your arms across your chest like this. I like to just hold them here. You can give yourself a nice big hug. This is also a good option. But for the spine, I like to just keep my hands on my chest. So again, hips, lower body in cement, and here we go. We're flexing forward as much as we can go. Once we hit the end of that, rotating our sternum to our left side, dropping our left shoulder and left ear down towards our left hip, and then rolling back. You can see it's very similar to the neck car because it's the same joint actions. Once we roll all the way to the other side, we're going to drop our right shoulder, drop our right ear into that hip, and then rotate our sternum into that side and come forward again. So we're going to go one more time in that direction. Same idea, rolling back, sternum is up to the ceiling, and then we're coming back down into that right side and back to center. From here, we're going to rotate the other direction, dropping that hip to the right side, rolling back, doing our best to keep the rest of our body stable. And remember, this is really so yes, we're trying to avoid as much compensation as we can, but there's no right or wrong way to do this if you're not, as long as you're not in pain, and as long as you're not feeling something that feels completely new and strange and weird to you, there's no wrong way to do this. So that's the spine in two different directions, 2 times in each direction. So now we're going to go to the scapulas, hands right by our side, keeping that irradiation contraction, lifting our shoulders to our ears, pulling them forward and down, trying to get just the movement at the scapulas. Now pinch our shoulder blades back as much as we can, lift them up, forward, and down. I like to do 3 scapulas because it's simple, short, and it feels so good. And down. Now we pinch back, but before we lift up, we're going to bring our shoulder blades back forward, then lift up, then pinch back in the elevated position, and then depress our shoulders down like we're trying to put them in our back pocket. Forward, up, pinch, bring those shoulder blades together, down into our back pocket. Oh yeah. And one more time, forward, up, pinch back, and down. Good, now we're gonna do our shoulder glenohumeral joint CARs. Taking my glasses off because sometimes I hit myself in the face. So we're gonna start working on the right arm, left hand on the ribs. First thing we do is open so that our palm is facing away from us. Our thumb is always, for the first part of this, turning outwards. So from here, we're gonna bring that arm straight across our body, keeping the elbow straight. We do not want this. If we're getting this, we're compensating. We want to do our best to keep our elbow straight, even if that means we don't get as much height, that's okay. So turn out, keep our elbow straight. Once we can't go any further, we start to bring our arm up, trying not to compensate through the body, bring our bicep right past our face. Then we should get to the position where our fingers are pointing straight overhead, and our arm is right on top of us. So now we internally rotate. So now I'm turning my palm behind me, but not just my palm, my elbow, my upper arm, everything is rotating in that direction. Once I can't rotate any further, I start to bring that arm behind me, continuing this extension and internal rotation until I can't go any further, and I let the arm rest right at my side. The back of your palm should be touching your thigh, the outside of your thigh. So now we're gonna go back. Same idea, still internally rotating. Once we hit that roadblock and can't go any further, we turn the palm up to the ceiling, externally rotating, keeping that going, up, up, up. Again, we get to the point where our fingertips are straight up over our head. Bring that bicep back past our face, still rotating that thumb down towards the ground, keeping that palm up at the ceiling and the elbow straight. Right back to where we started. Here we go, one more time. Same thing, elbow straight, palm up, bicep past our face, fingers to the ceiling. Rotate our palm behind us along with our forearm, elbow, bicep. Everything is rotating. Squeezing back as far as we can, trying not to move our ribs and spine. Back of the palm rests against the outer thigh, and we go right back to it. Once you hit that roadblock and can't go any further, you externally rotate, palm up to the ceiling. That's it. Keep that elbow straight, fingers to the ceiling, bicep past the face. Lower our hand right back to starting position. Okay, let's switch to the other side. Right hand on our ribs. You can keep it by your side too. I like here. I feel like it just helps you stabilize a little bit more. So palm facing away, thumb turning out. Straight elbow. Up, bicep past our face. Reaching those fingertips. We're trying to make a big circle here, as big as we possibly can. Now I'm going to internally rotate, sending that palm behind me. Yeah. Keep that arm going into extension. Pull behind you, and you can't go any further. Let it drop and rest right at the outside of your thigh. Back of the palm should be touching your outside of your palm. You should be fully internally rotated here. So keep that internal rotation and extension behind you as far as you can go. So I'm pushing my arm to the wall behind me. Can't go any further. Rotate up. Palm now faces the ceiling. You should feel a lot of stretch through the chest, through those front shoulder muscles, the deltoid. Here we go, up, over. Beautiful. One more time. Internally rotate. You should feel that stretch through the bicep as you do that. And back. Again, stretch in the front, feeling the back shoulder muscles working around the scapula, maybe even close to the armpit area. Rotate the hand up and across. The shoulder CARs can feel a little confusing at first if you're not used to them, but after you do them, they become very intuitive. So now we'll do elbows. We're gonna do one at a time. So again, hand is straight out to the side. We start by flexing our elbow. The whole time our elbow stays tucked. Now, without moving my elbow anywhere, I'm turning my palm away. It's like I'm rotating that forearm. I come down, rotate out. Again, flex, squeezing like I'm trying to crush something with my bicep, turning the palm away, down, and back. Now that's twice in that direction. So now I'm gonna start with my hand pronated. So the back of my palm is facing towards the camera, so your back of your palm should be facing away. Squeeze. So the elbow stays exactly where it is. The only thing moving here is the forearm. Good. Turning out. So this is a supination. Palm now faces me. Come down, engage that tricep to come down. Beautiful. We'll stick with this side and do the wrist. So to create a tabletop here with your forearm. And we're gonna do just two slow, full ranges of motion with our wrist. I like to do it with my fingers out like this. That's one. You can also make a fist. Both are really good options. So that's twice in that direction. Now I'm gonna turn. And to not overcomplicate it, you're just making a big circle with your wrist. But you're not doing this, right? This is one thing. This is my whole arm is moving. You're doing this. This forearm, this, whatever you call this, your humerus is stable. The only thing moving is the wrist, okay? So you're gonna find that's a lot harder. It's gonna create a lot more demand for these tissues of the forearm. Let's do the elbow and wrist on the other side. So flex, turn away, down. Start back at the same position, palm facing away. Flex, turn away, down. Good, now we'll go the other direction. Flex, now the back of the palm is coming towards me and turning away and down. Pronate that arm again. Flex, supinate, down. Good, we'll do the wrist on this side. Again, whichever you prefer, if you prefer a fist or you prefer the blade of the hand out. The important thing is that forearm is moving as little as possible. Beautiful. So that is the upper body. Now we're going to do the lower body, starting with the hips. So I'm going to grab these for balance while I show you this. You could just as simply grab a wall, grab a door frame, grab some person, whatever, it doesn't matter. Just something that's going to keep you stable. So for the hips, again, these are like the shoulders, same ranges of motion. And it can feel complicated at first, but I promise you after a while it will become intuitive. So we're gonna start with the right leg. Right leg is gonna cross over the left, so it's gonna put us into a hip adduction. When you do this, do your best not to shift too much with the hips. Try to stay right over that left leg so that we get true adduction. Because if I do this, now I'm getting adduction, sure, on that right side, but on the left side too. We wanna really focus on just this right side. So from here, I'm going to bring my ankle up to the ceiling, keeping the inside of my ankle and my knee up to the ceiling as far as I can. Once I can't do it any further, I'm going to start to bring that leg out. Notice how my hips are not turning out much. We don't want this. This is a whole different thing. This demands so much more of the musculature and tissue. So this is about as far as I can go. Now I'm going to let that outside of the ankle start to come up towards the ceiling. Again, that's about as far as I can go because I can feel my pelvis start to compensate. Back behind me now, acting as if I'm squeezing a lemon between the back of my knee, keeping that heel to the butt, letting the knee come right next to the other knee. So right knee's right next to the left knee, and then back the same direction. So now the outside of my knee is coming up as far as I can go. That's it. From here, I'm going to internally rotate, bringing that inside of the ankle up. That's the end of my range of motion, and back to where I started. So this, you're going to find it can feel quite difficult. Go slow with it. Take your time. Don't worry about it being perfect, but do your best to avoid those compensations. Because if I'm doing this, sure, I'm getting something out of it. It's not like I'm not getting anything, but I'm not getting nearly as much as if I am doing this. Fully engaged. I'm using these sticks to help create some tension through my upper body as well. Some core activation. And you can see there's a lot less movement when I dial it in and try not to compensate. That's okay. It's not about the overall movement, it's about the quality of the movement. Good. Now I'm going to do the left. I'm going to show you the left side from the side because I want you to see the difference between when I come back, arching my back to do it, versus staying locked in and keeping that back stable from arching and not excessively arching like this. Okay, so same starting point, left side over the right side, knee and inside of the ankle up. Now I'm going to come out here as far as I can without turning my pelvis. That's about it. From here I bring the outside of my ankle up and I can feel my lower back start to compensate, so I'm going to start to engage through my core to prevent that from happening. Good. Remember, I'm squeezing a lemon between my knee, the back of my knee right now. Here we go. That's the end. I'm going to come up with this and around. back down to the starting point. So one more here, inside of the ankle, knee up to the ceiling. Now I'm bringing that knee out to my side, trying not to move through my low back, internally rotating outside of the ankle up, bringing that heel behind me, squeezing my heel to my butt, letting the knee rest next to the other one before we go back for that last rotation. Here we go. There it is. And back down. You can hear I'm probably breathing a little bit heavier. These are very hard. So like I said, go really slow. Don't worry about perfect movement. Just do your best to try to minimize those compensations and to feel the movement. It's more about feeling, improving our proprioception. I'm also going slower than you have to go. This video is going to be a little bit longer than what the routine would normally be for the educational purpose. So next we're doing knees. So knees pretty simple. I give my knee a big hug. I'm doing it seated. You can do the standing too. I like the seated version better. I just think you can get more out of it. I'll show the standing before we finish. So giving my upper leg a big hug. I'm gonna start by bringing my heel to my butt and turning my foot out. So there's the tibial tuberosity and the tibia here. This is what we want to make sure that we're getting movement at. So as you turn, if you're turning your ankle, but this isn't moving, I want you to really focus on trying to get that to move as you turn, right? So here we go. We're going to turn the ankle in now that we're the heels to the butt. And I'm going to lift up as high as I can go. That's about it. And I'm turning my ankle out, trying to turn the tibia as well as I come down, squeezing as far as I can, rotating in again, up, out, down. So that's twice in that direction. Let's go the other direction now. So keeping this tibia turned out, coming up, in, down, out, up, in, down. So that's it for the knee. We're going to do ankle CARS. Again, to not overcomplicate it, we're just going to do a big full rotation, but I want you to really go slow and use that big toe as if it were like a marker that you're drawing through the air, keeping those toes spread. So again, you can see how slow I'm moving here. So what you get out of this versus what you get out of this, it's a very different thing, right? So now I'm going to go back the other direction, keeping that tibia stable. The only thing moving is my foot, my heel, and my ankle joint. Good, super slow, super slow. Good. Now we'll do the other side. So again, give yourself that big hug. Turn the ankle in, squeeze your heel to your butt, then bring your foot up as far as you can, turn the ankle out, squeeze it in. And remember, when you turn the ankle out, you want to make sure that tibial tuberosity, that pointy part of the shin bone, is moving as well. That's tibial rotation. That's so important to the mechanics of our knee. If we do not have good tibial rotation, that means that those forces that are being transferred and dissipated through our leg are getting jammed in certain places, right? So we want to make sure we can rotate here. But again, this is pretty intuitive, pretty simple. Up, down, in, out. That's it. One more for bonus. Good, so that's the knee. Now, we do the foot again, the ankle. Super slow, super controlled, twice in each direction. Sometimes I'll hold my tibia to make sure that my tibia doesn't move. Now this is going to require a lot more engagement of these lower calf muscles, the peroneals, the plantar flexion muscles in the back, the deep muscles. So if you're not used to using these, it could be a little frustrating. You might not be able to get that and feel that access. Don't worry about it. You'll come over time. So I'm going to stand up on this box for the last piece, which is the toes, so that you can actually see the toes. So this one's super simple. Big toes into the ground, other 4 toes come up, switch. This is not exactly a rotational movement, but it's great for the intrinsic foot muscles. And you're just switching back and forth, pressing the big toes down, the other 4 toes come up, Pressing the 4 toes down, keeping them pressed. Bring those big toes up. And do that a couple times back and forth. And then lift all the toes, spread them and reach. And then curl them in towards the heel. Lift all the toes, spread and reach. Curl them in towards the heel, which is the short foot. Good. So that is the full body CARS routine. We did spine, shoulders, elbows, wrists, hips, knees, ankles. And we did some foot work, some foot and toe work. Nearly all of the joints in our body just got movement that it wouldn't have had through maybe the entirety of our day if we didn't do that just now. Think about that. So if we have all of these joints that are not getting movement day after day after day after day after day, what's going to happen to them? They're going to lose their range of motion. Our bodies respond to the demands that are given to them. So we have to give them demands that's going to give the response and adaptation that we want. And the adaptation we want is healthy joints, healthy tissue that moves well, glides well. So this is a great everyday routine that you can do to accomplish that. Like I said, do it as slow or as long as you want. You could do this as quick as 5 minutes if you just crunched for time, or you could literally take 15 or 20 minutes to do this. So yeah, have fun. If you have questions, please ask me. If anything hurts, don't do it. Talk to me. We'll modify. We'll find a way to do it that doesn't hurt, or we'll find a different movement for you that will accomplish the same goals. And remember, don't move through closing angle pinching, specifically in the neck, right? Anywhere, shoulders, hips, but specifically the neck. If you get some cramping while you do this, that's okay. It's not pleasant, but that's part of the process, unfortunately, when we're doing active mobility work. So have fun. Let me know.